Hi there and welcome to this video. Dr. Sandhu here from Bedford Chiropractic Clinic, Doctor of Chiropractic and owner of Bedford Chiropractic Clinic. With over 25 years experience, I am the most experienced chiropractor in Bedfordshire, having treated over 30,000 patients and completed 130,000 plus adjustments. So today I'm going to talk to you about pain here in your thoracics, and maybe you're concerned about sort of this hump here, and you may even have some rib pain. You may even have some pain here at the front of your ribs as well. So today is all about thoracic pain, sort of pain at the base of your neck and pain maybe in the front of your ribs. So I'm going to talk to you about how I here at Bedford Chiropractic Clinic can help you. Now, the reason that you've got this pain may be because of some trauma, it may be because of some accident now or in the past. For example, a road traffic accident that you may have had sort of 15, 20 years ago, sort of potentially wearing a seatbelt, right, may have caused some rib problems which are now showing up. Because please understand that any kind of issue, problem, any kind of trauma that you've had in the past can leave your body and your ligaments, your muscles, your tendons with a weakness which will then potentially show up as a problem later on in life. So that could be the reason. And one of the things that you and I are going to do when we go through your initial consultation, when you call us today and get yourself booked in, is we are going to talk about sort of the reason why you've got the problem. We're going to find out why you've got the problem, because the reason that you have is so important, because by looking at that we can then go ahead and find ways to resolve the problem, not just for now but for in the future as well. Now let's start with this little hump that you may be concerned about here. It may be causing you some ache and stiffness across the shoulder blades here. You may have some pain down here as well, and you may be concerned that you're getting a little bit of a hump here. Now don't be too concerned, right, because that hump is not something that's structural. As you go down the spine here, these spines are quite prominent, but the reason that you've got that problem is because what you are doing is you are doing exactly what is shown in this photo here. Is your head is too far dropped, so you're creating that stress in here, and that stress may be giving you neck pain, headaches, maybe giving you sort of pain down your thoracics, and potentially low back pain as well. Because as you move your head forward from this position to that position, you're increasing the stress on your body from the weight of the head to something like 60 pounds of stress going into your neck and your shoulders and into your low back as well. So it could just be a simple thing as a posture problem. It may be that you're spending too long on your phone. It may be that you're on your laptop. It may be that your monitor is too low when you're working on there as well. It may be that your pillows are not right. It may be that you've had a fall. It may be, as I mentioned earlier, an accident that you've had in the past, road traffic accident, or some kind of sporting injury. You may also be experiencing a problem here in your rib cage at the front. Now there is a condition, an inflammation condition called costochondritis, where the cartilage here in your sternum can get aggravated and inflamed, and that is potentially a problem that is self-remitting, in the sense that normally that inflammation will subside after a period of time. Sometimes it won't, because that might cause then tension here in the back of your vertebra here, where the vertebra and the ribs attach, and that tension may then perpetuate the pain that you're experiencing in your ribs. And that was exactly the case that I had with a young man who was only in his 20s, where he was getting this pain, and he was given the condition of costochondritis and just given some painkillers, and the pain wasn't going away. So after months and months and months of sort of just taking painkillers and not sort of getting the problem resolved, he came in, and what we found was that his main problem was that these ribs in here were really stiff, because he was training very hard physically with martial arts as well, and this tension here was actually causing the stiffness in his ribs, which was causing the inflammation at the front. And that is the beauty of what I do, is we are going to be looking for the reason why you've got the problem and getting rid of that. Because by getting rid of the underlying cause of the problem, we're going to resolve the issue for you. So posture is definitely something that has an effect on it, and as I said, injury may be causing that as well. But you and I will discuss that and we'll get to the bottom of it. And then what am I going to do for you? Well, what I'm going to do is I'm going to get everything moving properly, get everything working properly, get everything checked so that your body then can function normally as the muscles work better, as the muscles relax, as the joints get their range of movement back. Your body is going to be pain-free, okay? Because the reason that your body is hurting at the moment is because the joints are stiff, they're not moving in their full range of movement, which is then creating the muscle tension, which is just perpetuating the problem. It's like a sort of a cycle that keeps going round and round. Muscle tension, joint stiffness, muscle tension. And that's what the cycle that we're going to break for you when you come and see me. So how do I do that? Well, over the 25 years, I've learned numerous techniques. And if you're worried about sort of the forceful, harsh sort of chiropractic adjustments that you may have seen on YouTube videos, then please don't worry, because I don't like that kind of adjustment done on me. So over the 25 years, I've learned multiple techniques, and the most gentle technique that I use now is called an activator. It is very, very powerful, very specific, and it will complete the adjustment for you in a sort of, I'm not going to say completely painless way, but certainly it won't be as forceful as some of those manual adjustments that you've seen. Obviously, depending on you, we will do some manual adjustments as well. But I'm here to help you. Don't put up with sort of thoracic pain, don't put up with rib pain, don't put up with this pain at the base of your neck. Come and see me today if you're in the Bedfordshire area, and I will help you today. Give us a call down there, the number is down there. Dr. Sandhu, Bedford Chiropractic Clinic, the most experienced chiropractor in Bedfordshire with over 25 years experience, here to help you resolve your pain. Don't rely on painkillers. Right, let me help you today. Call me now.